So let's go to prostate cancer. Prostate cancer has been getting a lot of notoriety in the public lately, where prostate cancer screening has always been very controversial, and we don't know yet whether or not prostate cancer screening is of benefit in the long run for this slow-growing cancer. The problem with prostate cancer is that it's still the #2 cancer killer in this country. And to simply say that, well, the way we screen patients nowadays just isn't good enough to save a life within 10 years is an irresponsible statement, because this cancer is still the #2 cancer killer in the country. It simply means we need to get better at screening, and we need to look at what we were actually trying to do with screening. We weren't trying to save someone's life within 10 years. Because if they had a prostate cancer that was likely going to kill them within 10 years, really only God could help them. Taking out their organ and having discovered that they had prostate cancer, really not going to change anything. We're talking about a 20-year life expectancy or a 15-year life expectancy. We've always said that progressing on with prostate cancer treatment really requires that the patient have at least a 10-year life expectancy, given all their other comorbidities, given all their other illnesses. And we've always said that. We're not interested in allowing a patient to choose treatment, you know, when they come in having just had a heart attack, or you know, they just don't have a great life expectancy, or they have some other cancer that's threatening their life within 10 years. So prostate cancer screening never meant to change life expectancy within 10 years. It's meant to help you beyond that. So for the patients that come in today, we say, well, yeah, if you only want to live 10 years, then you ought to just do nothing. If you're interested in living beyond 10 years, then you're interested in prostate cancer screening, because that's what the screening does for you. Screening's very easy. It's a blood test that the government thinks it's too expensive. It's a digital rectal examination that most men love to hear that they don't have to have, but you do. You should do it. The prostate sits very close to the rectal wall. We are only feeling the backside of that plum of an organ. That's true. We're only feeling the back of it. So you might ask, you know, well, you're only feeling the back of it. Why is it so important? Prostate cancer loves to occur on that back peripheral zone. In fact, over 95% of the time, that's where it first starts. So the rectal exam is a perfect screening tool for prostate cancer, because that's where 95% of it first starts, in that back peripheral zone. Histologically, that zone doesn't even wrap up anteriorly to the top side. It's only on the back zone. And that's why the rectal exam is so critically important. If either of these tests are abnormal, then typically the urologist will ask the patient if they're interested in a biopsy. Today, the only way we can know if you have prostate cancer is to press on with a prostate biopsy. And it is typically done in the office, and nowadays, as opposed to 15 years ago, it's a lot more tolerable. It is done with an ultrasound probe that's slipped into the rectum, and we're able to visualize the prostate in a two-dimensional ultrasound screen. And we take multiple biopsies and wait for the results. Once a patient's diagnosed with prostate cancer, they have many options, assuming it's localized, and we go through all that data with the patient and make a clinical assumption that it's localized to the prostate. Then they can choose to not be treated or to be treated. And if they choose to be treated, then we go through this list with them. They can essentially burn it, freeze it, or take it out. And we go through the risks and benefits of each of those modalities with the patient. It's a very individualized decision that typically the wife and or the partner of the patient help decide. And it is very individualized. No matter what they choose, these types of treatments come with potential quality of life issues because of where the prostate sits. Here's the prostate here. Here's a blow-up of it. Your bladder runs right through the prostate in the form of the urethra. It's sitting right on the rectum. There's these tiny organs back here called the seminal vesicles. These come out with the prostate if he was having surgery. And again, the bladder runs right through it. The nerves and the vasculature that control erections run right at 5 and 7 o'clock on that tiny organ, and they're very intimately related to it. So no matter what treatment option the patient chooses, it's a very difficult space to avoid trouble. If the patient chooses to have surgery, they then have to decide, do they want to do it open or do they want to use minimally invasive techniques? And if they decide to do it minimally invasive, do they want to just do it laparoscopically with a surgeon that says they know how to do laparoscopic prostatectomies, or do they want to do it robotically? So still lots of decisions to be made. Obviously, open surgery has many advantages. Our hand, unlimited range of motion, it allows us to feel and gives us great visibility to a certain degree. The disadvantages is the incision has to be big enough for our hands, which result in increased pain and longer hospital stays, which translate into more cost. In addition, the disadvantages would be having your own eyes down in that tight field. It is very hard to see what we can see nowadays. Laparoscopic, straightforward, basic laparoscopic radical prostatectomy has its advantages. Small incisions, we already went over that, decreased pain, shorter hospital stay, decreased cost. The disadvantages are the very simple instrumentation that you've already seen and the two-dimensional imaging in this very deep pelvic organ. Very hard to get your three-dimensional sense for these delicate structures that we need to get off. So basically, this now robotic type of surgery has revolutionized our field of urologic surgery, particularly as it relates to prostate cancer. This organ is so difficult to remove laparoscopically that the robotic technique has really turned this around, where we can have even greater dexterity than our own hands, better visibility in this tight spot, and those little tiny instruments dissecting off those structures which are of utmost importance to any man. In addition, the patient gets a lot of benefits. In addition to that incredible dissection, the benefits are obvious. There's first of all a marked reduction in blood loss. That's particularly important for our patients who absolutely refuse blood products. We honestly can't remember the last time we've ever had to transfuse a radical prostatectomy patient who was done robotically, and we've done hundreds. And that's not true in open surgery. It's typically recommended that you bank some blood and have it on hand, and so it's very different. But I think pictures really will show you just how great this is, so I'm going to get to the videos here fairly quickly. We have shown in our urologic literature that there are fewer complications doing the radical prostatectomy robotically. Again, dramatically less blood loss, less post-operative pain, obviously, than having the open incision, and quicker return to normal activities. The recovery in general is a lot quicker. We call this the trifecta because in prostate cancer surgery, we're not only worried about cancer control, we're also worried about this guy getting his urine control back and his erection function back. So that's why prostate cancer kind of highlights, if you will, the recovery from robotic surgery being so dramatically different from open surgery. I did open radical prostatectomies for many, many years, and I can tell you my practice is dramatically different now doing them robotically with respect to how quickly patients get return of urinary control back and their erection function back.